Good afternoon, everyone. Once again, my name is Kara Friesen. I am the Associate Director of Health Services at Nationality Service Center in Philadelphia. And NSC has been working for the past year on this refugee health promotion work to provide training and resources across the state. And today we are very excited to host this session on lead education for refugee agencies. So thank you everyone who is on here joining us for this presentation today. I'm very excited and privileged to introduce our speakers. First is Dr. Meera Siddharth. Meera is one of NSC's and other agencies in Philadelphia's wonderful partner through her work with CHOP's Refugee Program. She has been with CHOP's Refugee Program since 2011, and I know she has served a number of our medically complex children, and we have so appreciated her coordination and expertise over the years. And joining her today is Dr. Mohammad Iqbal, Mir Wali Khan. And I'll share a little bit about him as well. Mohammad Iqbal is a trauma surgeon from Afghanistan who worked alongside the U.S. military in his home country. He was resettled in Erie, PA after the abrupt withdrawal of the United States troops in August 2021. Mohammad embarked on a new chapter of his life alongside his family. He swiftly integrated into his new community, channeling his skills and experience into a role as a special projects manager with MHEDS. He is also a visiting scholar with Children's Hospital of Pennsylvania, which brings him here today. He has been advocating for health-related challenges of the immigrants and refugee communities in Erie and nationwide. And we are so excited to hear from Dr. Meera and Dr. Mohammad today. We will have time for questions, and as they present, you can put those in the chat as well. And I can either, bring those to the doctor's attention, or we can have those at the end. So with that, I will pass it along to Dr. Meera and Dr. Mohammad. Thank you again, both of you.
Thank you so much, Kara, and thank you everyone for joining us and for allowing us to talk to you today. And we're going to talk about lead, but kind of trying to put it from the point of view of case managers and the kind of questions that you might get from your clients, and hopefully we'll be able to give you some background about lead, the effects of lead, the sources of lead, both worldwide and locally, and a little bit about how to counsel people about lead and how to sort of be a liaison and help your clients coordinate with the health department. So and I can't see anyone, so if ever, I know that there are people, they're familiar faces here or familiar names, and just want to say hello, but I unfortunately can only see my screen. So when we talk about lead, lead is a naturally occurring heavy metal. And then in the US, it's found in high levels in industrialized cities, especially around Pennsylvania. We see them in Philadelphia and Erie, where Dr. Mohammad and I both work, but throughout the state, there are very high lead levels. Because this is an older state, it's often found in older homes, in the paint, in pipes, in dirt, in dust. And in the past in the US, it has been found in the gasoline. Just for comparison's sake, the US removed lead from the paint in 1978, but it was not removed from gasoline until 1996. Now, the reason why we care about lead is that when it is ingested by children especially, it has very severe effects, neurocognitive effects on the brain. So some acute symptoms that children may have are irritability, mental dullness, headaches, difficulty with attention, memory loss, tremor, seizures, and it can, in very high levels, go as high as a coma. And, in Philadelphia a few years ago, for those of you from Philadelphia, there was high lead levels in some of the schools. And many of the children who were school age, due to their exposure, actually were having these symptoms. there are long-term effects of lead as well. If someone has had long-term exposure and they have a consistently high lead level, they can have lower IQ, decreased memory, decreased executive function and attention, decreased processing speed, reading comprehension difficulties, decreased visual, spatial skills, decreased motor skills. And this is something that's important to keep in mind when you have clients who are from areas that have endemically high lead levels, even for the parents. The parents may have been exposed as children and may now have these long-term neurocognitive effects. So screening for
Mira,
lead.
sorry, Mira, I'm going to
Yeah,
interrupt you just for a second. Sorry.
sure.
There's a black screen on the PowerPoint that's covering up the title. I don't know if.
Oh, huh. Is this better? Oh, I see it. Huh.
Yeah, I'm not sure where it's coming from.
Huh. I'm not sure either, but well, you can see
Well,
most of it. So
yeah, we can see most. Great. Thank
sorry.
you.
Yeah,
That's
I'm
okay.
so sorry about that. I don't know what that is.
It's all good. Thank you.
Yeah. Okay. Well, I'll be reading it out. Now I can't see it either, but anyway, we'll work it through. But here in the US, we do screen for lead at ages 9 to 12 months is the recommended time. And again, at least at 2 years of age. And sometimes if a child is at risk because they're putting a lot of things in their mouth or living in a very high risk area, we will do it more frequently. And those with elevated blood levels above 3.5 are considered at risk for neurocognitive issues. This has changed. I mean, when I started as a pediatrician many years ago, the level that we looked at was above 10. And then several years later, they put that down to 5. But as more research has been coming through, it really shows that even at levels of 3.5, we see these neurocognitive changes. Oh, I'm so sorry. I'm having trouble now moving the screen. Okay. So we know that lead is a worldwide issue, and some of the areas that we especially see some high lead level are in South Asia. So Afghanistan, where we see our Afghan families come from, and then Bangladesh also has some very high lead levels, and we're seeing some Rohingya families coming from there, but also sub-Saharan Africa, parts of South America. So the dark red are really the highest levels. And we are seeing this in the children that are coming from those areas. So lead sources can come in from many different places, depending on where someone's coming from. So oftentimes it's in traditional cosmetics that Dr. Mohammad will talk about more, especially from Afghanistan and South Asia. Lead batteries are an issue in Southeast Asia, especially the Burmese refugees who were in Thailand and Africa. To their traditional remedies, lead will be found because it has a sweet taste, and it also causes very bright colors. So we see that from Mexico, Southeast Asia. Many countries have had, later than the US, have banned lead in their gasoline. For example, in Afghanistan, it was banned in 2016. And I believe Algeria might have been the last country that was known to ban the lead in the gas. And then there's candies and spices, again, because it's sweet. Many countries will have put that into candies and spices. And then cookware from Afghanistan, South Asia, Mexico, and South America. So there are lots of places where if someone is having a high lead level, to ask families about, because they may be buying some of these things at their local ethnic stores that still may have the lead in them. So, in terms of refugees, not only are there worldwide sources of lead, but refugees are often also resettled to areas in the US with endemically high lead levels, such as areas in Pennsylvania. And they're often in poor and substandard housing, which again increases their risk for exposure. And because of this, even though we usually in the US stop getting screening children at the preschool age, the CDC recommends that refugees and immigrants be screened up to the age of 16 for lead. And lead does stay in the body for a long time. So it stays in the blood for about a month. And in the soft tissue for about 1 to 1.5 months. But once someone has had lead in their system for 25 to 30 years, it can get into the bones. And it can especially re-enter the body during times like pregnancy, breastfeeding, aging, and also if someone had a broken bone. And so for this reason, lead is also a risk to the fetus for a pregnant female who has a high lead level, and it can be also at risk because it passes through the breast milk. And for this reason, it's recommended that pregnant and breastfeeding women be or women of lactation age or who are able to have children also be screened for lead. So this is something that we're trying to work with OBGYNs and educate them about, but this may not be something that if you have a client who is pregnant, that their OBGYN is aware of. So oftentimes we ask mothers to talk to their OBGYN about that and make sure that the mother is screened.
Hello, everyone. I'll be taking over the next part of. Can everybody hear me? Right, okay. So I do wanted to set a stage for the talk that I'm going to give by beginning with the lead study that was authored by Dr. Lena. Addressing the prevalence of elevated blood lead levels within these communities, and also set a stage to see that what Meera has already talked about, and I would like to elaborate on the issue that it is not something that is just worldwide. We are dealing with this issue locally, and in Pennsylvania, when Dr. Lena conducted this 5-year study. And found out, next slide, please, and found out in this table, because I can't read the table, hold on, let me go to my table. If you can see the table, where the prevalence in the Afghan community, where the total number of the children that were tested, 157 children, and 88 children were found out to have elevated blood levels, and the percentage comes to almost 70% of the children that are coming from Afghanistan are testing positive for lead. And the list. And it also gives us a very good idea of the time frame in which the study was conducted. It was 2015 to 2020, and we do know the next slide, please. And we do know that majority of the clients or the refugees that we're seeing actually started coming in after 2021. That gives us a very good idea of how much the issue of lead in the current years have the community centers, the health centers are facing. In this slide, I just wanted to give you a visual example of how the Afghan community, the Afghans that were coming to the United States, they did not plan for the event, and it all happened in a matter of days. And I would also like to share an example of the lead exposure and the health promotion activities that we're doing at MEDS within the Afghan community, and emphasizing that this issue not only affect one community, that is the Afghan, but everyone who comes to this country. And Afghan population in the United States are indeed disproportionately affected by lead exposure even before they move to the US, and they continue to be at risk even after resettlement. Next slide, please. And I want to shed some light on the challenges for the Afghan community that they face in dealing with elevated blood lead level. First, it's the total lack of information and knowledge about lead poisoning, and many Afghan refugees may not be aware of the dangers associated with lead exposure. And education sessions and awareness campaigns are essential to address this challenge. And another significant challenge is that many Afghan refugees arriving to the USA post 2021 have not had access to formal education, and this lack of education can hinder their ability to understand and address the lead-related risk factors. And some Afghan refugees continue to use or consume products that are contaminated with lead. And these include the cookware, the spices, the cosmetics, and the jewelry. And it is crucial to educate the community about the risk associated with these items. And the pre and the post. So after resettlement, so some of the risk factors that are the older homes in which they live, having lead-based paint or plumbing, can contaminate water supply, posing a significant risk to these communities. And identifying and addressing the lead hazards in the housing and infrastructure is vital to mitigate this problem. The other important challenge is, of course, we're all aware, is the transportation. Transportation is a big challenge, along with language barrier for the Afghans and the refugee communities to seek access to healthcare. It's important to consider their mobility and ensure they have easy access to resources and medical facilities, not just identifying and then following up on the care, the medical care that they need. Next slide, please. So at MEDS, at MEDS Clinic, what we took the initiative to start lead educational sessions. So now these counseling sessions, I like to describe them as we actually, it was a learning curve for us how to do lead educations. So explaining what lead is to someone who is not familiar with it is itself a challenge. So I used to explain it very technically initially when we first started the sessions, but I soon realized that it was not working, and it is important to keep the explanation very, very simple and easy to understand. The just defining the word lead in Pashto and Dari as a toxic metal. Created confusion because the word metal can be a synonym for word iron in Pashto and Dari. So for clients or for people that are on iron supplement for anemia, for any other purposes, they got scared that, are you giving me poison when we are saying that lead is poison? So, and then of course explaining the sources, the clinical manifestations, and the long-term effects of lead to the Afghan refugees. I've personally found out what captures the attention of most Afghan individual is when I start talking about the neurological effects of lead in their children, and also the sexual and reproductive effects, such as infertility, miscarriages, and so on. That is where when they really start to paying attention to the issue. Next slide, please. Just like Meera said, that it's not the only the Afghan issue, but throughout the board, the Asians, the African communities, the Latin American communities, they all have certain ethnic component of the exposure. Meera already explained this slide, so let's go to the next one. Is For those of you who are not familiar with the strange-looking device with a handle on the top, it is actually a pressure cooker, and every household in Afghanistan you will find this cookware. And the reason why I'm showing this cookware is that during the smelting process, they would use scrap metals, batteries, ammunition, everything, and then create these different cookwares in which the percentage of lead usage is very, very high. And while I was doing some research that, okay, if it has lead, will that actually the amount of lead that is exposing into the food will lessen over time? No, it's on the contrary. The more you use it, the more it gives out lead. So as soon as we identify any cookware, any cooking utensil in the house that is contaminated, they have to discard it, they have to recycle, or they have to get rid of it. And for the way we did that was to introduce home testing, self-testing kits that they can get actually from the stores like Home Depot, Lowe's, or even online the Amazon, or the other online stores. And also not very it's very inexpensive, 20-30 bucks. They get it, and the way they do it is just brush on it and it will change color if it's contaminated. And the alternative to the pressure cooker was also shown to while we were doing the educational session, by using Instapots or any other device that would do the pressure cooker job. Next one, please. And the other source that we identified was the most difficult one, is Surma, or they also call it Ranja. It's the mascara that majority of the Afghan households, especially the women and the even newborn children, they would put them on. And in this picture, the child is wearing the mascara. She's actually my daughter. She was that she's 10 months now, and that is when she was 2 months old. She was two months old. And my wife, she put the mascara on as soon as I saw it, and I was like, honey, what are you doing? Stop using, we can't do this. We didn't know that, but now we know it. We can't use it. And also, there was this family. I want to give you a case of when I was doing the educational session, and this family, they were video calling back home. And so the mother-in-law is back home, and she's showing a video of her child to her mother-in-law. And the mother-in-law looks at the child and says that, why is the kid not wearing surma? And then what kind of mother are you? You can't take care of your kid? And that is the mentality. Uh, and it's not only that, the use of surma or the mascara in the Afghan culture is deeply integrated, and it is linked to religious practices, and and telling them to stop using it just goes beyond cosmetics. It involves challenging their culture and challenging their religious beliefs. So uh, we and the other interesting thing is that the use of sarma is deeply woven into the fabric of Afghan poetry and Afghan songs. You go to YouTube and you just type Surma, you will get plenty of songs in Pashto and Dari that glorifies the beauty of eyes if it does not have Surma. So uh, and we did manage to find an alternative to Surma by going to the cosmetic stores at Walmart, Walgreens, and all these places where they can get the Surma or the mascara that are branded and not contaminated with lead. And with that, I will transfer it over to Meera.
Thank you. Thank you so much. It's so interesting. I always learn so much from you. Um, just talking about when you're talking to families about all the different places that there may be lead exposure, this slide just kind of reviews both the ones that are found in the home, such as the paint, the water pipes, the dust that we were talking about, as well as medications, cosmetics. There are also occupational and hobby exposures. If you have a family that is working in construction, then the dust from the clothes can have lead in it. I had a patient, was not a refugee, but the toddler went and hugged her father every time he came home. And that was where her lead exposure came from, was from the dust from his clothes. So then he began to remove his clothes before seeing his child and make sure that they washed out the clothes every night. So, but when asking, sometimes it requires a little bit of detective work to figure out where the exposure is. And this is just a little bit of do's and don'ts to review with the family, is that, because there's often in Philadelphia, there's just lead in the dust everywhere you go. So just practicing some best practices is really important. Washing your child's face and hands often, especially after playing outside, washing toys and pacifiers daily, leaving shoes at the door to keep the dust from tracking through the house, which I think a lot of the refugee families do anyway. Making sure to give healthy meals with, high in iron, calcium, and vitamin C. And then, like I said before, changing out of work clothes before entering the house. And, things not to do include letting children play where there's bare soil, letting them sort of, if you have chipped paint, making sure that they're not placing their furniture toys near chipped paint, especially near windows. Don't let them touch this. Be careful about jewelry, especially if it's imported, because that may contain lead. Some toys sometimes can contain lead as well. Don't give the children candy or toys from other countries. And then also, as Dr. Mohammad said, be careful about serving food in lead containing and making food in lead containing cookware. And this is just, this is just examples of what iron-rich foods are, calcium-rich foods, and vitamin C-rich foods when talking to families about and this actually, by eating these types of foods. And when someone has a high lead level, we actually start them on an iron supplement, a vitamin supplement, because that actually helps get the lead out of their system. And, people may ask, well, what is the treatment of lead? Our patients ask that all the time. There's no medication for treating for lead. It's removing the source and then just hopefully if you catch it early enough and remove the source early enough, it will cleave out of the system. If they do have higher levels of lead, then there are medications to help chelate the lead, and that helps also take the lead out of the body. But for the lower levels of lead, it's just sort of removing the source. So, what happens when a lead screen is elevated really depends on where you live, because different counties handle it differently. Just from talking to Dr. Mohammad, we've discovered that Erie County and Philadelphia County have very different ways of managing lead and also different resources in managing lead. But the Department of Public Health will be involved. And families may get a telephone call and be worried. That happens a lot with our refugee families, that someone speaking English is calling them. They sound official, or someone with an interpreter is calling them, and they're saying there's something going on with their house, but they don't know what lead is. They may not have even realized they were screened for lead. And in fact, just yesterday, one of my colleagues, I heard her on the phone with the lead department because they had called our office because one of my colleagues' patients, who was a refugee from Democratic Republic of Congo, had not let the lead department or the inspection home inspector come into the house to inspect the home, understandably, because she didn't know who they were. And so my colleague, called the mother back and explained to her what lead is and why this was important, and then called the inspector back and rescheduled the inspection, and then called back the mother. And then, she told me about it, and I let her case manager know, just to make sure everybody was on the same page. But, sometimes things get the communication can be a problem with these things. And, depending on the level, the family may need to have a home inspection or require lead abatement of the house, or the family may have to move from the house because of the level of lead. And we've seen that happen to all in different families, to all our patients. All of those issues occurred. And, again, the source often is a combination of both things that they're being exposed to that they've brought over, and also issues going on in the home. So, what you can do as a case manager, and hopefully this talk will help with that, is educate your families about the risks of lead poisoning, advise safe alternatives for cosmetics and spices, share some of those best practices on prevention of lead exposure, encourage a healthy diet, be familiar with your local county's lead prevention program and how to connect your clients, and serve as a liaison between the client and the Department of Health, especially if they're having trouble reaching out to the family and connecting with the family. And I want to thank everyone for your time. And I think we have some time for questions and comments.
Thank you so much, Dr. Meera and Dr. Mohammad. I do have a question regarding like the candies and the cookware and the spices. How much of a concern are those imported items? Like, how much have you seen personally that is an issue that we should really be aware of and kind of keeping an eye out for if we are like visiting the client's home?
I mean, it's definitely something that that is an exposure and a concern. Especially if here in Philadelphia, there are all these kind of like local little candy shops and candies that are imported, that in the neighborhoods that you'll find. And I just always warn about that because, again, lead is sweet. That's why kids like to eat paint chips. And so, it is a risk. So I always just kind of talk about it and warn against just being very careful about those type of candies.
Any other questions from the group? I know I have a couple, but if you aren't able to speak, you can put it in the chat and I can read it out loud. While we're waiting for that, I did have another question, Dr. Mohammad. You talked about the home test kits. And you mentioned how practical it was. I'm curious too, like how many folks or households took action after finding that they had tested? Were people like pretty motivated once they saw that they were testing positive for lead on their cookware or ever? Did they hesitate to buy new items or did they take action on that pretty quickly?
Well, this is a very good question, because after they get they're they are diagnosed, or it's a established case of elevated blood level in the house. In the meantime, if there are other children in the house and they also get tested as elevated lead, or are negative for elevated lead levels, they try to seek help, and all the different ways of how to mitigate the issue is and then this is where some of the help actually also comes from the state, is that we did when we got our ARSP grant and we applied for this project by doing the lead education along with giving out the testing kits, and which is in the process, but we did got a go ahead to give out the lead testing kits to the families that we do the education sessions with.
Great. I also have an additional question. And then, yeah, I would definitely welcome if anyone else has questions, since we have these experts here with us today. But how could like a case management team or health workers from our agencies kind of reassure families, maybe their home has tested positive for lead, but it's been remediated and it's has been deemed safe to move back. How much certainty can we kind of like reassure them with of like, yes, it is safe to go back? Because I know I can think of at least one case where there was a lot of hesitancy, even after the home had been remediated, to move back into that home.
That's a really good question because especially, I find that when I'm talking about lead with families, because they didn't know what it was, it just really throws them for a loop. And then, and then it's hard to trust to go back there. Uh, you know, um, One thing I let people know is that this is something that, the health department is very well aware of, and that they're experts in making sure that that environment becomes lead free. It's the cynical part of me said nothing can ever be 100%, but just kind of reassuring them that this is something that the lead department has been working on for years, and that the people who remove the lead have that experience and expertise.
Great. Oh, we do have a question in the chat. Someone is asking, could we refer our clients to the training sessions that you host? I believe, Dr. Mohammad, this one's directed to you.
Yes, and it is from Ragad. Yes, Ragad, definitely. I'll share my contact, and we can definitely, depending on the language, the way we do it is the language specific educational session. So the Afghan languages, the African Swahili, Kinyarwanda languages, Arabic languages, depending on what language, sir, clients your clients are speaking, we can definitely arrange something for them.
Thank you for answering that. Yes, I work a lot with the Afghan community, so I would definitely be looking for that.
No, that is an absolute pleasure to work with your clients. Yes.
Thank you.
We have
Another thing,
another,
oh,
sorry, go
I was gonna
ahead.
say another thing we can also share is there are a lot of materials in several different languages about lead. So what I can do, Kara, is send you those links, which may be helpful also for
Yeah,
caseworkers to share that.
that would be great. We should have the email address for everybody who attended today, so we can send that out. And there's another question in the chat. Asina is thanking both of you for this important presentation, but she was curious if there's any specific spices that have lead that maybe are more prone to having that in that she could be aware of, or our teams can be aware of.
Yeah, go ahead, Meera.
No, you go ahead, Dr. Mohammad.
The spices that are actually identified of containing lead and are contaminated are some of the brands that have some of the brands of cinnamon. So we and turmeric. So we are asking our clients to avoid those brands, and you can easily find them on your state website, and the state websites and other. The place I usually go is CDC that have those specific brands. But anything I would just, if it's contaminated, stay away from it.
Yeah, that is mainly cinnamon powder and turmeric powder. The whole cinnamon and the whole turmeric, they are safe.
Yes, yes. Thank you, Lena. Turmeric and cinnamon.
Yeah. And if they stay with non-imported spices, those hopefully will not be contaminated, although they're not always quite the same.
Especially powdered. Yeah.
Mhm.
Any other questions? Okay. Well, I'm going to go and pause the recording.